The British Menopause Society is a society that's been around for about 30 years, and it is the specialist authority on menopause and post-reproductive health in the UK. Our main aim is to educate and to provide information and guidance for healthcare professionals.
There's a whole range of symptoms. So as our ovaries are changing in function, our estrogen level changes, it's involved in many parts of our body. So while flushes and sweats are really common and well known, there's also other symptoms of mood changes, joint aches, palpitations, sometimes difficulty sleeping, irritability, anxiety, a whole range of things. Then, for example, if they have joint aches, if it's not known that that can be associated with hormonal changes, then that may lead to unnecessary tests, unnecessary consultations. There's a whole range of types and products and doses of HRT, and there isn't one type that suits all. So the key messages are that for most women who have troublesome symptoms or have risk factors for bone health problems, osteoporosis, then the benefits of hormone replacement therapy far outweigh the risks. But it isn't necessary for all women to take HRT, and they might just want to know what's available and then actually see how it goes, because symptoms do change.
So you've got maybe children of 5 or 6, you've maybe got children doing their GCSEs, you maybe have parents who need help, and what goes to the bottom of the list? Oh, it's just getting old. How many women say, oh, I don't know what, I'm just getting old? So yeah, we need to encourage women to go forward and ask. There are a huge number of GPs out there who know a lot about menopause and are really, really good at looking after women. And then there are some who are not quite so confident. And there seems to be quite a lot of GP bashing, which we really don't like. There is education out there, and a lot of GPs are now taking education because the profile is so much that women are constantly asking, so they have to know the answers.
We are, though, aware that some women have more complex histories. For some GPs, they may not be confident in the advice that they're giving or the prescribing that they're doing. And for those situations, we do have menopause specialists, and we are hopeful that one day every region will have a menopause specialist service. Through the British Menopause Society, we're providing important education on a regular basis, and we have specific training aiming to develop these menopause specialists.
Well, we're all getting much more conscious about menopause. We all know a lot more about it because of programs like Davina and Mariella. One of the things that is quite worrying is making sure that women are getting the correct information, because now, as a result of these fantastic programs, there's a huge amount of information out there, but it's very difficult to pick out what is information and what is misinformation. And that's the beauty of the BMS, that you've got a medical advisory council, and they are the top national and in some cases international specialists on menopause. So when we produce something, it's got the consensus of all those people, so you know it's going to be authoritative and authentic and correct, which is really important.